My name is Ron Watson, and I'm here to talk to you all about why I support Amendment 2. I like to tease and say that I'm a scumbag lobbyist, and I say that to try to get a reaction from people. And then I try to explain to people what lobbyists actually do, and I think that we're a very valuable part of the legislative process. I have represented dentists for 10 years. Before that, I represented medical doctors, and before that, I represented osteopathic physicians. So for over 20 years, I have lobbied on behalf of healthcare practitioners. So I found myself in a very interesting, unique position to kind of speak out on this. Again, because with all due respect to Mr. Morgan, he has sued doctors for a living, and I have represented doctors for a living. And so maybe they might be a little bit more willing to listen to a Republican who believes in this and has gone through things in his life that has made him rethink certain things and what's important in life and what's not. So I was fortunate enough to be in a position to be able to help pass the low THC, or what's more commonly known as the Charlotte's Web bill, this last session, Senate Bill 1030. And part of my motivation for doing so was when I heard what I call the mama bears testifying. They had children with epilepsy that had been suffering through so many seizures that it was just devastating, and that they had no other hope left, and they'd been through 10 or 12 or 15 different medications, and the last hope was for their child to have their brain sawed in half. Or they could try to have a plant squished into an oil that has shown remarkable progress in other states. And it was the day that I actually heard one of the mama bears say that she prayed to God each and every night for God to take her child because of the suffering. And it was that day that I decided to try to make a difference in these kids' lives and in these parents' lives, because I too made that same prayer of desperation the night before my son passed away, because his suffering was just too horrible to withstand anymore. So that's part of why I believe in this, and that's part of why I'm here today to speak to you. Dylan is my son. His name was Dylan Montgomery Watson, and he passed away 8 years, 6 months, and 1 day. It's been about 2.5 years now, and I like to show you something here on my wrist. A very nice dentist friend of mine made me a wristband that says Dylan Watson, and on it, it says, "Be awesome, cool, and funny." And the reason it says that was because about 2 months before my son passed away, after a brave 12-month battle already, including a bone marrow transplant that nearly killed him, when I walked into his hospital room one day, up on the whiteboard, underneath where it said goals for the day, my 8-year-old child's goal for the day was to be awesome, cool, and funny. And what I try to do every day is live up to what an 8-year-old can do, dying of cancer. The other wristband I have, you can't see it now because her name has faded away, but this was given to me by one of the mama bears back in February that had Rayanne Mosley's name on it. And my goal in life every day is to make sure that this purple one never turns black. And I'm going to wear this purple one until that child legally gets the product that she needs to be able to change her life. And I hope that day is quickly arriving. It's not every day that you have an opportunity to truly make a difference in someone's life. And again, when you watch a child suffer and then you have to actually bury your child, things that you used to think important aren't necessarily important anymore. And what you realize in life is, how are you going to make this world a little bit better than when you found it? And as crazy as this sounds, I want this to be my legacy. And I want this to be my legacy based on my son teaching me what was right and wrong. Would you have ever asked me 5 years ago if I wanted my 8-year-old to have marijuana? I would have laughed at you. But you know what? What I've learned, I really wish I'd known what I know now when Dylan was going through what he went through. And I wish Amendment 2 had been on the ballot 10 years ago, because it frankly might have been able to make a difference in my son's life. But unfortunately, you can't unring that bell. And so what my goal in life, and what I want to be proud about every day, is preventing that bell from being rung for anyone else in the future. And this is a very controversial issue. A lot of people think that Amendment 2 is just it's a ruse, just so people can get high. And frankly, if you're honest, there's a small part of that. But what I've learned over the last 10 to 12 months is how really incredible the medicinal side of this is. And not just with pain, but there are different cannabinoids within this plant that we're still discovering. What we passed here in Florida is called a low THC or high CBD product. and that is allowed in Florida now, and we're in the process of trying to implement that. But back before that law passed, I basically quit my job because to be able to speak freely on this was quite controversial, and I needed to be able to have the freedom to speak my mind. So back in February of this year, I basically quit my very well-paying job and started my own business called Watson Strategies so I could speak on behalf of these kids. At the time, I didn't really have any clients. I just took a leap of faith because sometimes in life you just got to do what you think is right. Can you imagine your husband walking up to you and saying, "Honey, I have an idea. I want to quit my very well-paying job so I can go out and speak about medical marijuana. What do you think?" And I must admit, my wife, without missing a beat, said, "Ron, I believe in you." Shows you how crazy she is, isn't she? But she is my best friend. And what I learned from her, watching her take care of my son, I can't even begin to describe to you how powerful a mama bear can be. And I called her Mama Bear Extraordinaire because she dropped everything else in her world. Nothing else mattered but making sure our son was taken care of. And I fall deeper in love with her every day because of the strength that she showed me. I've been told by certain doctors that they believe, matter of fact, even some of them that have done commercials, that there is, quote, no medicinal value to this whatsoever. But strangely enough, included in Senate Bill 1030 is a requirement that the Florida Medical Association teach doctors how to properly prescribe the low THC. So how can an association be opposing Amendment 2 that it has no medicinal value whatsoever and simultaneously be designing a continuing medical education course to do just that? I think it's smart that doctors should have some training in this. It only makes sense. What if you're afraid that doctors won't prescribe anything? Again, that is a legitimate question. And I will argue that a lot of the doctors that you talk to, the vocal ones now, say they oppose it. But when you get them one-on-one and when you get them talking together, there's less resistance. There is some peer pressure, let's just say, and not the peer pressure that makes you go get drugs. It's the peer pressure that doesn't allow you as a physician to potentially speak your mind because of being judged by fellow physicians to be less than, or to be an outlier, or to be someone that just doesn't use science. And so I think what you're going to see is some resistance at first, a huge educational plan, and then doctors realizing how wrong they were. Why is Amendment 2 needed, and what does it do differently than what would occur in the law that's already been passed? And remember, we've passed a law on Senate Bill 1030 that was passed by a Republican House, a Republican Senate, and signed by a Republican governor. So we actually have support for this. Now, why do I support Amendment 2? Well, what happened in Senate Bill 1030, it's a very limited strain that's allowed. It has to be very low in THC, which is the mind-altering, or some would say euphoric feeling part of the plant. And it has to be at least 10% of CBD, which has been proven to help specifically with the epileptic seizures. It's wonderful, and that is a wonderful first start. But what Amendment 2 does is specifically list 9 conditions that would have to be available for treatment. Now, it does have language that says, or whatever else a doctor believes that the risks that the benefits, outweigh the risks. And so many have argued that that's a loophole that would allow every single person for a backache or whatever, I have a sinus infection or whatever, and that's truly not the case. The reason that has to be put in the Constitution is because you can't just list every single condition because it's in the Constitution. What if 5 years from now they determine PTSD is treated by this? If it wasn't in the Constitution, it wouldn't be allowed. So that catch-all that everyone's saying is the actual legalization of marijuana truly is not that. It's just basically saying that in the future, when we discover what else this wonderful plant will be able to treat, it won't be limited because it wasn't specifically listed as one of the 9. Join me on the right side of history. Vote yes on Amendment 2. When I started this way back in February, and I would go to some of my Republican friends, the first thing I would say to them is, you're on the wrong side of history if you oppose this. But you know what? To my great surprise, we ended up passing a marijuana bill this last session, controlled by a Republican legislature, signed by a Republican governor. So 10 months ago, when I kind of started off with the statement that my friends in the Republican Party are on the wrong side of history, I was wrong. For this to pass, it's going to take independents, it's going to take Democrats, and it's going to take Republicans. And if the numbers that I've been told are correct, unless 42% of Republicans vote yes on this, it will most likely fail. So I am here today as a Republican, talking to my Republican friends, begging you, vote yes on Amendment 2. There are absolutely politics behind this, but what I'm trying to do is trying to get past that and look at the actual medicinal value. When I first decided to do this, I did not know how I was going to be received. I'm the pot guy, okay? So here's a guy that's been working as a lobbyist for 25 years, and all of a sudden decides to go out and speak about this particular issue. I think I had the ability to do it because a lot of my friends knew that I'm just a crazy grieving father that had buried their child, and so maybe I got a pass from some people because they thought that I was just nuts because of the loss of my son. And so I'm okay with that. If that's what you need to believe to hear what I have to say, I'm okay with that. Again, I was pleasantly surprised at my reception. I was also pleasantly surprised that a lot of my Republican brethren turned out to be on the right side of history. Some of the most conservative members of the legislature were the ones that were my first early vocal supporters of this. It was an amazing journey, and this was a bipartisan effort. I mean, you look at the House bill, it was sponsored by a Republican and a Democrat. They ran with this bill together. It truly was neat to see the process work. It doesn't always, but occasionally it does. What is my vision for medical cannabis? First of all, I hope it passes in Florida. But interestingly enough, I do believe that in 3 to 5 to 6 years, the federal government will probably reclassify this from Schedule 1 to Schedule 2. It may take a little bit longer, but when that happens, you're going to see this quickly become mainstreamed and quickly taken over by the pharmaceutical industry. If you read Amendment 2, what it says is that no government or no insurance has to pay for this. So unfortunately, what that's going to mean is more out-of-pocket expenses for the patient. But if the patient can get a medication that actually helps them, think about it. And now the insurance company doesn't have to pay for all the medications that weren't helping them in the past. Don't the insurance companies stand to save a whole lot of money here? Once they realize that, you'll see a huge change in this. Why should law enforcement support this? That's a good question. It really is a very fair question. Unfortunately, through the seizures, they have some financial stake in this. Each and every time I've ever asked a policeman if they've ever been called to a domestic violence disturbance because of marijuana, the answer is uniformly no. There's a reason for that. Let's talk a little bit about the economics of this. Not only would the decriminalization or medical marijuana increase tax revenues, it would also decrease criminal justice costs. It would also stop flooding our prisons with individuals who didn't do anything more than explore a plant. I truly believe that not only through the tax revenue, but through the associated cost savings, this has a potential to be literally hundreds of millions of dollars in savings for the state of Florida's budget. And I think we could all say that we would like the state to spend less money. How much money per prisoner? I've heard anywhere from $20,000 to $50,000, so I'm not sure, but so let's go $25,000. Do you realize that the United States incarcerates more people than the entire rest of the world combined? So mandatory minimums made everyone sound like it was great, tough on crime. We're going to be tough on crime, but you took a lot of discretion away. Now you have people serving 5 to 10 years mandatory minimums, for having nothing more than, a little bit of marijuana on them. And I think that those laws are wrong, and that we can eventually get to changing those laws as well. And when that occurs, I honestly believe that alcohol and tobacco are more damaging to society than marijuana is. And I think that will be proven over time. And did we not learn from Prohibition? Did we not learn from Prohibition? And this certainly has a medical benefit. Absolutely has a medical benefit. There is a fair argument that smoking is not the best delivery device. and that there will be, and the company that I'm working with, Mary's Medicinals, they developed a patch. The patch is you can be dosed properly. You can have not only doses but administrative routes that are controlled, and we're seeing progress there. And we're actually tracking patients. We're trying to get from the anecdotal aspect of these stories to actually tracking patients from the very beginning of coming in and trying this product to where they end up finding themselves. And so we're about to go from anecdotal to proof. Yes, on 2. Hope is a powerful emotion. And right now, a lot of these moms and these kids, they didn't have any hope. And passing this law gave them a lot of hope. Passing this amendment will give them even more hope. They call Amendment 2 the Compassionate Care Act, and I believe that's exactly what it is. They also called Senate Bill 1030 the Compassionate Medical Care Act of 2014, and that's exactly what it is. And I'm very proud of this legislature and frankly Governor Scott for signing it. But let's just say it didn't go far enough. And that's why I'm here to support Amendment 2. Amendment 2 will make the discussion continue in Tallahassee. And that's what I think we all want. We want to prove the medicinal value, and we're heading in the right direction. Help us get there. Please vote yes on Amendment 2.